Samantha, you can hear me?
Yes, I can hear you.
Okay, and remind me what you're going to be, what your role's going to be tonight.
Okay, hold on. I'm clicking on things and I'm not supposed to click on things.
uh,
Oh, there we go. You know, I use Zoom with my students and it's still like, I just randomly click on things. I'm a teacher. I'm a second grade teacher at Willow Creek.
okay, so you're a member of the committee.
Yes.
Okay, so you were with us last time.
Yes.
Okay. How you holding up?
Yes. It's fine. It's a lot, but it's fine.
It's a lot. It's a lot for everybody.
It is a lot for everybody.
Hi, Paula.
I was going to say good morning. It just keeps going.
I've lost track too.
Hi, Samantha. How are you?
Good. How are you, Paula?
How are your kids today?
You know, they were good. They worked hard.
Good. Yeah. I'm glad to hear it.
Yeah.
I'm going to black myself out because I'm just here to answer questions that you guys might have. So this is your deal. Thanks, guys.
Hi, Adam.
Hello there.
How are you?
Hi.
I'm good. How are you guys?
Good.
Good.
Looks like Brooke is. Hi, Brooke. How are you?
Hi. Good.
Lindsay, hello.
Hi.
Everybody doing okay? Living your best life?
The American dream, actually. Thank you for
Yeah.
asking.
Yeah, there it is. Peter, how are we doing on the presenter side? Are we okay there?
So the panelists are coming in here, it looks like, and all the panelists that would have the ability to show any slides or anything they've got. So any of the guests that may show up. I think we're configured correctly.
So panelists is there a difference where I'm seeing panelists and attendees? Is there a difference between those two?
Yeah, only panelists are visible on the video, and
Okay.
they're the only ones that talk. Everyone else is just a passive observer. All attendees are just passive.
Gotcha. Okay. Are we YouTubing live tonight?
Yes, this is being recorded and it is live streaming on YouTube. They're
Okay.
all YouTube celebrities.
Again. Hey, Peter, I just got an email from one of the committee members who apparently didn't get a link for tonight's meeting.
Okay.
Nicole Delabama.
Okay, I'll double check her and make sure we get one out to her.
Thank
I'll be
you.
right back. Roger, it looks like she was already listed and got the email, so have her connect up with me and we'll see if we can't find it in her junk mail or something.
Okay.
Hello.
Hello. Okay. Thanks, everybody. We're okay and get started here. There's a lot to get done, and I want to do just a brief some introductory remarks and then get right into it. So I would be grateful again if you stay muted until it's your turn to speak, and I mention your name. We're going to start with some input from some folks who can provide information that we requested. A couple of things I'll note. Not everybody wanted to go kind of back through a lot of data, and there were some questions about where should the data come from. There is what I did was my best job at trying to find the best places to go. And so I called, as I mentioned in my email to you all earlier, I called Dave Jepson, who is the director of Idaho Department of Health and Welfare, who is a friend of mine and a colleague, and basically kind of took his advice. You got to start somewhere, and I that's a person I trust. And so we're going to be hearing from some representatives of Southwest District Health. We're going to be hearing from a general practitioner in the Nampa area. And then I'm going to try to get right into your questions so that these folks, while they're here, can respond to you directly. And again, I want us to stay focused on our fairly narrow objective here, which is at the end of the day to make a proposal to identify metrics for moving into hybrid and remote to the district. So let me start with the Southwest District. Nikki, are your folks ready to go?
Hi, Roger. Yes, I believe they are.
So why don't we start with your presentation from your team, we're going to run through, folks. We're going to run through some data here pretty fast. Some of it you may already know, some of it you may not, but I think it's just good to have a place to start from. So we're going to start with a quick run through on some important data. So Nikki, if you'd go ahead.
Sure. Thank you for having us today. I'm hoping that we'll be able to address any questions that you have about information that we collect here at the district or how we use that information to help inform decision making and provide guidance. I am joined this evening, I guess, by Kim Beckley, who's one of our liaisons that works with schools throughout our health district, and also by Rachel Polreese, who's our data analyst. And I'll go ahead and let them introduce themselves quickly, and then Rachel is going to provide just a brief presentation on some of the data points that seem to be of interest to this group.
Good evening. My name is Kim Beckley. I am the school liaison, so I've been working closely with the schools and helping guide some of the decisions, or giving them the information that they need to help make good choices.
Hi everyone, my name is Rachel Polreese, and I am the data analyst for Southwest Health District. And I will go ahead and get my presentation started. I'll try to be quick. I know there were some questions for me, so. Okay. Can everyone see this all right?
Yes, Rachel, we can see it.
Thank you. Okay, so I'll just run through a few points quickly. This is a graph of the 7-day rolling average of COVID cases in Nampa. And this is for all age groups. You can see this is our current spike right about here that we're experiencing right now, about as high as our previous spike that happened mid-July, a little bit more, and it's about 80 cases per day on average. And I just also wanted to point out that on many of these graphs, you will see this decline right here. And from about this point on, this is just a decline from a delay in reporting. So sometimes you'll see that, and then the next day it'll kind of level out. So just keep that in mind as we go through these. And then this graph is the 7-day rolling average of new cases for the ages of 5 to 20. So specifically for those school-aged children. You can see we're experiencing currently about 10 cases per day in Nampa for children that are in school or just starting university. And so this next slide shows our positivity rate as well as cases by age group for Canyon County. Unfortunately, our positivity rate data is only available at a county level. And that's because the negative testing results are reported to the health district, to Department of Health and Welfare, and then is disseminated to the health districts on a county level. And so you can see here towards the end, these oscillations are just by report. So Mondays and Tuesdays, we have more reporting than on the weekends. And you can see that while our tests are going up, we're having more tests happening. Our positivity rate is also going up, which is indicative of an increase of spread of COVID in the community. And then over here, we have our cases by age group. If you check out our dashboard, you'll see that primarily most of our deaths are occurring in the 70 to 80 range. However, there's such a small percentage of the cases. The majority of cases are happening up here with 18 to 29-year-olds and really working aged individuals. So this next slide, this is available on our Tableau public website or our profile. And this is the incidence rate by school district. And so this is incidence rate of the community as a whole, not particularly just individuals within the schools, but anyone that lives within that district or potentially has children attending schools in that district. And if you visit our Tableau public website, you can see, you can kind of zoom in and see how many cases, what the incidence rate is for each of these different school districts. And so this is kind of a zoomed in version. This is the Northern Canyon County area and the school districts within that area. And then if we go to the next slide, we'll see Nampa School District right here. The incidence rate is about 6.8 cases per 10,000 people that live within those boundaries. So pretty high. That's categorized in our red health alert level category. Anything over 5 new cases per 10,000 would be considered red. So this next slide is just a brief overview of kind of what we've seen in regards to COVID in schools, and this is for all of Southwest Health District. So we're seeing the primary mode of exposure for the students is through household members. So that usually means that the parents will contract it or a sibling will contract it and then pass it along to their family members. Obviously, they're sharing a residence, so it's pretty easy for that spread to occur within a household. Next, we're also seeing that transmission is occurring from schools to household more so than from a household to a school. And that is primarily because of some of the quarantine measures that we've had in place. I know those can be really annoying and difficult to deal with, but that's really helped us in preventing the spread from a household to other members in the school. This next one is we've had 28 cases in Southwest District Health where exposure occurred in the school and then once later spread into the household in the last 30 days. And then for students exposed while attending school, the primary exposure is either through sports, after school activities such as clubs or riding the bus, and then high risk or special needs classrooms where it might not necessarily always be possible to physically distance or wear masks. And then also we've seen 25 cases in Southwest Health District that were directly linked to Halloween parties, which was their mode of exposure. And then briefly, I'll go over some of our healthcare capacity data. So this is all of the beds in Southwest Health District combined. This gray section here is total patients, and then the blue down here is COVID positive patients for inpatient beds. So all of the beds excluding ICU beds. The goal is about 20% or less for COVID patients. 20% is kind of the cap. And you can see that we're inching pretty close to that in the past few weeks. And then this is for our ICU bed occupancy. And you can see here the gray again is all patients, whereas the orange is COVID patients. And we're seeing over 30% occupied by COVID patients, nearing 40%. And so this last section, I'm going to go over a couple of the holidays that have happened this summer and this fall, and just show you that 7-day moving average of new cases in Southwest Health District and how those exposures from those holiday weekends might have affected some of these numbers. So we can see this is from Memorial Day weekend. Right here was the weekend, and then we have this 2 to 14-day incubation period. And so obviously not everybody takes 14 days. Sometimes it happens in just a couple days where they start to develop symptoms. And we can see a general spike here, likely due to some of those gatherings that happened over Memorial Day weekend. This next is from Independence Day weekend. So another weekend where we're seeing a lot of gatherings. Thankfully, in these past 2, we've really seen more outdoor gatherings and barbecues, things like that. So probably less exposure than our indoor gatherings, the sort of thing that we are potentially looking forward to with the holiday season coming up. And again, we're seeing a bit of an increase as a result of some of these gatherings. Next, we have Labor Day weekend. We didn't see too much of a spike from Labor Day weekend, thankfully. There is a little bit of an increase here, but I don't know if it's enough to correlate. And then lastly, we have our Halloween weekend. As I mentioned, we had 25 cases that were linked to Halloween parties that were happening. And again, we're just on the cusp of the end of that incubation period right now. So there's a potential to see more of those coming out in the next few weeks. And then lastly, I'm just going to go over our health alert level metrics for Canyon County, and then I'll show you a couple of the primary metrics that we're looking at. So this data is also available on our website. This is just some of the metrics that we use to determine health alert levels. You can see that Canyon County currently, as of last week, had a incidence rate of 4.9 cases per day per 10,000 people in Canyon County. Which is right on the cusp of the red alert level system, which is at 5. And then I had to split this dashboard into two because it was too long. But you can also see that the positivity rate was pretty high. I think the most current data, our positivity rate for Canyon County is nearing 17%. So it's actually increasing. And then on this last slide, we'll just look at some of the key metrics. So obviously the incidence rate is really important when we're determining these levels. Canyon County fell at 4.9, as I mentioned, so in the orange category here. And then these are just the cutoff points for each of these metrics. Next is our positivity rate. So the number of positive tests out of the total tests administered. And Canyon County was currently at 13%, so in the red category for that. Hospitalization rate, so the number of people hospitalized with COVID-19 out of the total COVID-19 cases. Canyon County was in the gray category for this metric. And then we have the percent of cases with a potential or a known source. So the measurement of community spread, how many people know where they were infected or have no idea where they were infected. Canyon County was at less than 70%, so in the red category. And then also our healthcare capacity. And this is a couple different metrics combined. So we have resources, including our beds, so capacity in the hospitals, how many staff are being infected with COVID-19, and then also our PPE supplies. So Canyon County was in the orange category with elevated concerns. That's primarily due to an increase in COVID patients in the hospital. So declining hospital capacity, as well as I think we had around 60 healthcare workers that were infected in the last 2 weeks. Thankfully, the PPE supplies have been pretty stable over the past few weeks. And then this last slide, if anybody wants to take a screenshot or write any of this down, this is our website here, and this is where you can find all of this data available. Our Tableau Public profile is right here, and this is where you'll find that school district incidence rate map. And then lastly, we have our call center phone number here. So you can call if you have any questions, if you need to reach out to any of us. This is how you can get into contact with us. And that's all for my presentation. I will wait for questions until that time comes, if that works out. Thanks, everyone.
Thank you. Yes, if you wouldn't mind standing by for just a bit, we're going to have one more a brief conversation, and then I'm going to open this up for questions from our committee. I also, if I'm not mistaken, I think that PowerPoint is going to be, or may already be, on the school district website. Is that right?
I believe so.
Yeah. Okay. So it'll be available in two folks for anyone who wants to go back through and review that in more detail. Is Dr. Womack with us? There you are. So what I'd like to do next is if you'd like to make any general comments, observations, just kind of run through your perspective, and then what my intention is to then open the floor to questions from our committee to both Dr. Womack and the folks from the health district to get clarifications, additional information, etc. So Dr. Womack, the floor is yours.
Well, thanks for having me. I'm a pediatrician, and I've been practicing in the Treasure Valley now for 20 years. And in January of this year, I started my dream job, which was actually working in school-based clinics in the Nampa School District. I work both at Central and Snake River. And today, actually, I was informed that those are two of the three schools that, as of tomorrow, will be closed until after Thanksgiving break. So basically, I think that decision was made due to lack of staff because of quarantines. They just basically couldn't keep the school running. And they're calling it a health break, I believe, and hopefully they're wanting to continue back in December. And I know that y'all are here to discuss what to do in this situation, and I certainly don't have all the answers. I don't know if I have any of the answers, because I'm the one who, back in February, when somebody asked me if coronavirus was something that we need to be worried about, I said no. So obviously that was incorrect, and it's just an illustration of how, we in the medical community especially in the beginning, had a big learning curve just like everybody else. But now that we're about 8 months into this, I think we do know more, both from things that we did wrong and from things that we did right. And I'm just gonna give my usual plug. Every time I'm asked to speak, I always like to tell people that masks work, but they only work if we all wear them, because they don't protect yourself, they really just protect others. And I just tell my kids and anybody who will listen to me, you know, think about it like wearing pants. Just wear them. Just kind of make it part of your daily routine. The other thing I think that we've learned just really in the last several months is that, you know, schools in general aren't usually a significant source of viral spread. And I think we know that from data from different countries. And I think that we know that for a fact now. The catch to that is if the school, the school is basically a microcosm of the community, right? So for the countries where they had good control, the schools certainly did not contribute to spread. For places that the numbers were rising pretty rapidly, you know, anywhere you go in the community, including the school, you're going to probably see those same numbers represented. And so that's the other thing I think that we've learned over the last several months. And then the last thing I'll mention is hospital capacity. I know as a physician that worries me quite a bit. I know that Twin Falls Peds floor had to close again because they just didn't have enough staff. A lot of nurses got COVID or they were quarantined because their kids got it. And so Boise is taking all of these kids from Twin, and I just really feel for those families. But y'all saw the numbers there. You know, it's but just, you know, knowing the families and speaking to them and how difficult it is that their child, in some cases toddlers or babies, are in Boise and they're in Twin trying to work and take care of their family. It's pretty devastating. So anyway, that's really all I had. Thank you.
Can you stay with us for a bit?
Yes.
Thank you. Okay, so a couple of things here before we go into questions. If you're to set up, I think most of you are set up on the gallery view. So you see basically it looks like Hollywood Squares. I'm aging myself, but and you should also have on the right of your screen a chat box. Not everybody is comfortable speaking out, and so if you'd rather type your question on that chat box, there's a little chat icon down at the bottom, and you can just type your question there. But so what we're going to do for the next, as long as we need to within reason, is take your questions to the district, the health district, or Dr. Womack, and also the superintendent is on board here and is available to ask questions as well. So now we're going into the Q&A phase of tonight's meeting, and we'll do the same thing as last time, and I'll try to get to everybody, but just raise a hand and I'll point you out. Nathan, you're up.
It seems like we have a pretty significant number of healthcare workers who are quarantined. And this could be either for Dr. Womack or Southwest District Health, but is there a way that the school district can help reduce those numbers? Is there anything we are not doing that we should be doing? Any suggestions you might have?
I'll let the health district take a stab at that first.
So this is Nikki, and I think the question was specific to healthcare workers. Is that correct, Nathan? Okay, yes. I see you nodding. Thanks. I think this is just, you know, my perspective that addressing healthcare workers, the best way we can protect them is with a community-based approach, because they are on the front lines and we are relying on them to be available to care for people, whether it's in our hospital settings or our long-term care facilities or clinics. and we need them to be able to see people. So I would say it's really our community's responsibility to take measures to protect their health and the health of their families. And that's the best thing they can do to help their healthcare community.
And Nathan, that's really nice of you to ask that. But I agree that it's not necessarily something the schools can do. It's just, each individual can do, right? And that is to try to prevent community spread. Because I won't lie, it is, I get worried. I have a husband who's got, who ticks off some of those high risk conditions that makes it a little dangerous if he contracts COVID. And I have to think about that, even though I love what I do, I do worry.
Samantha?
I have 3 questions, 2 regarding the data and then just a point of clarification. The school age positivity rate, you said it spans from 5 years old to age 20. Are all of those kids that are positive on that positivity rate enrolled in Nampa School District, or is that just the age range that you're looking at? My second question, do you want me to say all 3 or?
Yeah, go ahead, please.
Okay. And then my second question revolved around the Nampa School District positivity rate, specifically the 6.8 per 10,000. Is that the prospective students that might be enrolled in Nampa School District because of their location and address, or is that a positivity rate that is based on the teachers for Nampa School District, staff for Nampa School District, and obvious enrolled in the Nampa School District? And then my last question is a point of clarity. When you said that it was a school to household, not household to school, or whatever that slide mentioned, was that saying that students were taking COVID home from school? Or I didn't quite understand that point. Thank you.
Hi, Samantha. This is Rachel from Southwest Health District. So for the first question, you asked about the 5 to 20-year-old range. And that's not specific to people that are enrolled in in-person classes. That's just anyone 5 to 20 years old that lives in Nampa. And then the second question was about the incidence rate, which that for the Nampa School District is measuring the total population of that geographic area. So it's not specific to the students in the school or the teachers in the school, but just as Dr. Womack mentioned, what we're seeing in the school really reflects what we see in the community. When we have more cases of COVID in a community, we're going to see more cases in that school. So that's just anyone that lives within that school district. And then the last question, can you remind me what that one was?
Yes, I was just asking for some clarity. On one of your slides, you had 4 points of transmission, and the second one referred to school to home versus home to school or something like that. I just wanted to ask for you to clarify that.
Yeah, so you're correct. We are seeing it's more frequent that we're seeing a student is infected in a school and then they go home to isolate or quarantine, and then they're spreading that infection to their siblings or other family members or household members. That's happening much more frequently than a student being infected by a household member and then going to the school and infecting other members of their school.
Okay, thank you. Biff?
So I've got a question for Rachel. I was looking, I think, at the slide that said that we've had a total of 28 cases in the last 30 days where it was spread in the district, in one of the district schools. Is that correct?
Hi, sorry, I just had to go back and find that. So that is 28 cases in all of Southwest Health District. So that's out of our 6 counties. And that is where the exposure happened in the school and then was spread to the household. So from the student was infected, or student or teacher was infected while they were at school. And then as they were isolating at home, they infected other household members.
So that's 28 for the entire district, not just for Nampa School District.
Yes, that's correct.
If I could add something, I don't know if there are any Nampa school nurses on this call, but they could back me up on this. You know, being in the schools since they opened this fall, these numbers are pretty, I think I think the COVID cases are underrepresented. I think that if there is a family member, for instance, that's positive and their child gets sick with fever, you know, cough, etc., a lot of times they don't seek testing. I saw that quite a bit where I thought a child should probably get tested just again, so we would have that number, and you know, the family declines, and that actually happened. That happens quite often, and unfortunately, of course, we don't have those numbers. I didn't keep tabs of how many families declined COVID testing when I thought that a child might have it, but I believe it was significant.
We have a question, I think, again, for clarification here, going back to Rachel to the question is the time frame for that last data we were talking about. What period of time was that for?
So for the 28 cases, that was in the last 30 days. But if you're referencing in the comment from Amy, I believe that was aimed at Jean Fitzgerald Munchie.
Adam?
Hi there. So I think my question might be for the district, but possibly for Dr. Womack. How many people are currently quarantining and isolating, and maybe it's quarantining or isolating in the district? Because I haven't seen the latest data. The last data that I'm able to see is from 11/6 on the COVID dashboard. So I'm wondering, for the school district in particular, how many people are currently quarantining and isolating? And then a quick follow-up question is, what is our threshold at the point that we have to start closing down, just like Boise, for people being out?
Kim, do you have that information handy? I know that's something that we track.
Just pulling it up. What we have, this is just information that we have collected. Sometimes people are calling into the schools and they're self-reporting their quarantine, so we won't have those numbers. So our numbers can be a little bit different. Just one sec, I gotta count them up.
While you're doing that, I happen to know the Boise School District numbers. I don't know the percent, but beginning of last week, they had 1,000 school staff out, and by Thursday, so in 4 days, it went from 1,000 to 1,500 school staff out, which is, I think, when they made their decision to close until after Christmas break. If that helps.
Does the superintendent happen to know what that would be for Nampa, and possibly what our current numbers of quarantine and isolating teachers and students are, and other staff members?
Sure. So go ahead, Mr. Russell. Go ahead.
Adam, I don't have, I think all of it. What I do know is we have 63 employees right now that are quarantined and that can't work. And then we have 220 kids who are placed in quarantine. I think that's the latest information that I have.
Adam, in addition to that, we would have a group of children who are demonstrating symptoms, and our nurses in exploring possibilities have asked those students to go home as well. We don't know whether or not they're positive or not, but they are exhibiting the symptoms that we're following.
Okay, let's go to Brooke.
I think this is going to be for Southwest District Health, but if we close back down and we go totally online, is there an adverse effect on hospitals for staff? So, you know, if we go back online, does that pull more workers out of our healthcare field? Do we know that metric?
Hi, Brooke, that is a really good question. And that's not data that we track, but we recognize that when things are shut down, like if schools are not in session, that we don't want children home alone, that can impact the workplace and likely healthcare setting as well. And I do want to maybe just, I don't know that we completely answered Adam's question, but I just want to clarify the health district wouldn't make a determination on when the school closes. At least that's our board's position at this time.
And to further that, as parents, is there a program for that we're not aware of, right? Like, I know that the school district was really good at setting up a care program when teachers had to go back to work online. Is there something like that for the healthcare field as well? Maybe a Southwest District Health question?
Brooke, I'm not aware of something that's available.
Yeah, totally fine. Just wanted to see if there was that I knew.
Hey, Brooke.
Thank you.
Back in the spring when it happened and when we were in complete shutdown, I know that there were certain places like the Boys and Girls Club that were remained open so they could take the children of healthcare workers. In Boise, I think in Nampa too.
Okay, other questions? No one dares fix their hair because they're going to think I'm going to call on them. Go ahead, Adam.
Sorry, I was just waiting to see if other people had a question. What is the current, I think this is for the health professionals here, what is the current level of risk that COVID enters our schools on a day-to-day basis with the level of community spread and percent positivity? What are we looking at as far as our risk levels by remaining open?
Is Dr. Hahn on this call, our state epidemiologist?
She is not.
Oh, okay. So, you know, I'm really a pediatrician in the trenches. I'm not an epidemiologist per se. So I am just taking a fairly educated guess. And I would say the risk is high. And I can't give you any numbers to back that up. But that's my feeling. Yep,
and I'll piggyback on Dr. Womack. I am an epidemiologist by training, so I have a little bit of background in that. And I would just echo what Dr. Womack said. Unfortunately, we don't really have a quantitative risk level that we can provide you. But at this point in time, and just as my lights just went off. Just as the data that Rachel went over with you, you can see where we've been during this COVID epidemic and where we are now, and definitely heading in the wrong direction.
Okay, I'm going to go to Kyler next, and then Kim, I see you, and then we'll go to Biff after that. So Kyler next.
Thank you, Roger. Looking back at what it is our goal for this entire thing, we've been asked to recommend a set of metrics to move between online and hybrid education within the school district. Previously, it was simply Southwest District Health says red and we go to online. Obviously, as you've provided metrics for us, some of them show red, some of them show orange, some showed gray, frankly. I suppose your ideal scenario, if you could point to one of those metrics or a collection of those metrics and say, when those go red, man, get them out of the schools. What would be your suggestion in this case?
So I'll take that.
Go ahead.
I'll take that first because it's, I know that slide you're referring to, that wasn't all red, right? There was red, there was orange, there was one gray. But that, it's just a snapshot. What I would look at is the trend. That's the biggest that's more important than, you know, a snapshot in time. And unfortunately, the trend kind of looks like that. You know, it's not even that or that. It's kind of like this. And so that to me is even more important than that slide, because I agree, it's like, oh, doesn't look that bad. But I mean, each week it's getting more, you know, I feel, I tell people it's almost like I've stayed healthy so far. But I feel like, you know, and before people would say, oh, you know, I don't even know anyone who has COVID. And, you know, I don't think many people can say that anymore. I feel like it's kind of like closing in on all of us, especially us healthcare workers. And it frankly makes me nervous. So I would say, again, I'm not, there are a lot of factors that I'm not privy to, you know, because I'm in the healthcare field, I'm not in the schools. But from where I sit, we're not looking good.
No, and I appreciate that. And granted, the one gray area that did exist or that I noticed was the fatality rate. That's not the metric to use. And I understand that that's not the metric to use. I simply suggest that maybe there is more pinning down that as a committee, again, our goal is simply to suggest a set of metrics for stay open versus hybrid versus online learning. So thank you.
Nick, Kim.
Yeah, so I wanted to just kind of clarify some things. So as you said earlier, the school district is a microcosm of their community, and the more cases that we see in the community, the more we are going to see in the schools. So in the process of limiting exposures in our community, because all of our students are part of our community, all spread out and all then come together and then spread it then, as we could see throughout the rest. After holidays, in some cases, we see those increased trend lines. With that being the possible amount of exposure going up, not only in our district, but also in the community, would you say that that would be a good time in which we would decide that the numbers are going to get too high and possibly have to go remote learning?
I'm going to, whoever wants to, Dr. Womack or anyone from the district, anyone who wants to weigh in on that.
Well, this is Nikki. I almost felt that was more of a statement than a question. We are very concerned with the trajectory of where we are headed with the community. And one of the aspects that's most important to the board and to the district is our healthcare's capacity to respond to not just our COVID patients, because they're not necessarily even the majority of cases that are hospitalized or individuals that are hospitalized right now, but overall the burden is really stretching our healthcare resources thin, and our healthcare staff, as has been pointed out already on this call, that they're also impacted by COVID within their households. So that is what becomes alarming to us when people have to delay maybe what we call elective procedures, but that doesn't mean unnecessary. And those could be related to cancer treatments and other things. I have a friend of mine whose brother just had to have an emergency amputation, and and potentially down the road, there was a space for him to be able to come in and do that. But I was talking to the CEO of West Valley yesterday, and they had more patients than beds in their ED, and all of their ICU beds were full at the moment I was talking to her. And obviously that changes moment by moment, but that's not normal for them. So that's really concerning to us. And to Kim's point, with the holidays coming and understanding that families will be getting together likely, and people will be going back from school break, and just there's a lot of risk for more spread, and we're already not in a very good place.
I want to let you all know that I do see the contact tracing questions here, but I want to get to Biff next, and then we'll go to those.
So I guess I have a couple of questions. The first one, probably for Southwest District Health, is when we had our first lockdown in March. Do we have any data that shows that doing online helped bring down the curve? And I guess my second question is, if we do go to online, how is that going to, I guess, keep the kids from getting COVID?
Those are great questions, Biff. And I'll just say from the lockdown, I think it would be pretty much nearly impossible for us to say if closing schools and going to remote learning during that time helped. And the reason I say that is because everything was shut down, and it would be really hard to say really, what was the one key thing. And likely it was probably a combination of people not working in certain industries being closed and events being closed and gatherings being postponed or delayed. And then in terms of the online learning, I don't know if I can really answer that question other than just say that I think what we're really trying to promote right now are just the basic behaviors that help slow the spread of COVID-19. And we know that social distancing and staying within family units and practicing all the good hygiene messages and behaviors is really important during this time.
I want to go back to make sure we've addressed this satisfactorily. The question on the chat box for the district, and I know the superintendent has responded to this, but for the health district as well, where are we in terms of contact tracing? How close in timeline are we in completing the tracing from when the case is identified?
Yep, I'm happy to take that question for the district. It sounds like the school probably has some of their own process in place too. And Kim might have some things to add. Because of the situation that we are really in across the state, there was a decision made late last week where pretty much all the public health districts in the state and the Department of Health and Welfare had to prioritize how we handle new cases because we're not able to keep up with the volume that's coming in. So right now we are only investigating cases that we receive a lab report for. If we receive the lab report within 72 hours of the test being done. So anything that's, the lab doesn't get it to us, 5 days after the test was done, we're not investigating those, and we're not doing any contact tracing right now. And the reason for that is just the volume of new cases has exceeded our capacity across the entire state. So we are doing our best to investigate those cases and that we can get investigated and prioritize those, and then ask people to who know who their contacts are to notify their contacts of their exposures. And I don't know if Kim has something to add specific to the school work since she works in that area.
Well, it's along those same lines. We have definitely seen an increase in the number of school age as well as staff at schools that are testing positive, and it's been extremely difficult to keep up. We are trying to, schools are one of those priorities that we have, and even then we're not able to get to all of them in as timely of a manner as I would like to.
I see you, Samantha. Let me give me just one moment. We're now approaching an hour into the Q&A part of this, and I'm happy to go as long as you all feel like you want to. But I'm just making note of that. I do want to bring us to a close for tonight by 6:30. So I just make that note, and we'll proceed. Samantha?
I just have a question about when do we, as a district and as a health district, draw the line of, okay, this is where we're at, this is what we're dealing with, in terms of the public health, the school health, teacher health, student health. So that, I mean, because COVID is not, I mean, I'm not an epidemiologist, I don't really know these things, but I don't foresee it ever going away. It's going to be something that's always here. So as it always rears its ugly face, are we always going to be going back to this parameter of shutting schools down, shutting the public down? Like, where does the Southwest Health District predict that it's going to draw the line and say, this is the normal with COVID, here's where we go from here? Because I mean, I've heard all of this many times through the school board meetings and your awesome presentation. So I just want to know, like, where's our finish line? Like, where do we draw a line?
Samantha, that's a really great question. And I wish I had a crystal ball, but I will tell you that we will all get through this and it will be better at some point. I'm sure, just as much as anybody else, want to have our normal back. But what I can tell you is we probably still have a little bit of a long road ahead of us. I don't think that Rachel shared this information in her presentation. Right now, I think in our district, I think you may be as specific to Canyon County, Rachel can probably confirm, but I think we're sitting at about 5 to 6% of what we consider prevalence, meaning people in our area have tested positive for COVID. Now that's just people we know about. We know that's probably a very small amount probably of the number of people, because we've had bad access to testing for so long, and then so many people are probably asymptomatic and don't get tested. So it's probably larger than 6%, but we probably have a long way to go before you'd say we're not going to continue to see these really large increases and kind of outbreaks in our population over time. I think a vaccine, if we have an effective vaccine, which it's looking promising right now, I think that will really help get us further along without as many illnesses and deaths. But I think we're probably well into next year before we really feel like we're starting to come out of this. And that's, I'm not the expert on this. That's just, my feeling based on what we're seeing right now and my professional judgment, I guess. And Dr. Womack might have something else to add to that.
Well, I feel, yes, Samantha, it feels like, we keep reacting, this happens and we do this, but again, we've gotten smarter over the last 8 months. And so first of all, I think it's going to take probably 1 to 2 years to kind of go back to normal. I think a lot of us feel like eventually COVID-19 is going to be like influenza, where there's like a spike in the colder months, and we'll treat it kind of like flu. We'll have shots for it that are available seasonally at the very least, but we're probably 1 to 2 years away from that because of we need herd immunity through a vaccine. That would be ideally how we would achieve that herd immunity, and that's going to take a while. But I think we're still in crisis mode, to be quite honest. In fact, it's even more. I'm thinking back about the panic this spring, when you can see from the graphs that the cases were a small percentage of what they are now, and now we're all like got COVID fatigue, and so even though our numbers are horribly high, crazy high, and there's no end in sight, I think we're to the point where we're just weary of it. But this is definitely not the time to feel that way. We need to, while the trend is the way it is, we need to take I think we need to take these drastic measures to try to get them to go back down again and get some semblance of normal, and get our schools back open, get our kids back out doing their sports, etc.
I want to make note of a couple of things. We've got a side conversation going on the chat box that is starting to move toward the ultimate objective of this group. And so I'm getting a sense that there are some of you who are kind of moving on, but I want to make sure before we do that, that we have, that we've asked the questions and gotten the answers that you want to get from the folks who are here to provide those answers, and then let them go have dinner and move on. I want to, real quick, I see your hand, Samantha. I'll be right with you. Biff, I want to make sure that you got your question answered from before. Do you feel like that you heard what you needed to hear there?
A little, I do. I guess I'm looking at the purpose of the lockdown or the going home. It sounds, if I'm looking at the data, and I know that some of the data is skewed with the spread in the schools, but it looks like it spreads more out in the community than it does here in school. And so what would be the purpose of sending them all into the community all the time, where they have a safe haven where the spread isn't as much here at school? So I guess I was curious, the purpose of, or what is that supposed to fix? I guess I'm trying to wrap my mind around that.
So I'll try to take a stab at that, because it is a very good question, and one that a lot of people have. And as a mom with kids that I don't want in my home all the time, I get it. So if that's decision that's made, I think the reason why to do it is it's not because if we shut the schools down, COVID's going to go away. It's part of what we, or what the community has to do to get these numbers to stop going exponentially and start coming down. So it's part of the solution. It's not the solution, because like I mentioned, schools aren't, if the schools are doing what they're supposed to do, which they actually have been doing a fantastic job of, they're not the reason for the spread right now, but it certainly isn't helping, and it is still putting people at risk. But it's only you can only keep the schools open when the trend is going down. Otherwise, it does contribute. Maybe I can't tell you how significantly, but it absolutely does contribute. And so when the trend of COVID incidence is going down, then that's when we can have the conversations about opening up safely. But when the COVID incidence is rising exponentially like it is right now, then the reason to have conversations about school closure is to help stop this community spread.
Samantha, I think you had a follow-up question. I see your hand, Brooke, and I see your hand, Amy, and then I would like the indulgence of the committee to see if we can bring this to an end with the next few questions. If there's something that's absolutely got to be discussed, but I'm going to try to break this off with Samantha, then Brooke, and then Amy, and hopefully we're going to be about there.
It was just a follow-up statement / question. My question wasn't necessarily about going back to normal. It was, the phrase I absolutely can't stand is that new normal, but I'm going to use it right now because, as you said, we have a year or two invested in this COVID experience. Where do we say in this new normal that being in school, while it's a minor part of the community spread, is something that is worth for the students, the teachers, the staff, the parents, or with how small it is, like what's the metric that you would recommend that we look at? I feel as a committee, we need something that's like defined so we can say, okay, when we meet this is what we should be doing. When we meet this is what we should do. And I think that kind of falls in line with Kyler's question of where in these metrics that are presented should we be really focusing? I feel like I'm kind of being pulled in multiple directions here of making this decision.
Before I go to Brooke and anyone else who wants to respond, let me just say you are being pulled in multiple directions. There is absolutely no doubt that's what makes this so vexing. Dr. Womack, did you have a comment?
It's been a while since I've looked at the data, but they've been looking at this at different countries, based on the amount of spread. So if you've got a country or community where the spread, there's widespread, it's very widespread, and it's the incidence is rising, then schools contribute to that rise. If you have a community where they're doing a good job of doing all the protective measures, and they're actually having a decrease in the incidence of community spread, then you can safely open schools, and that doesn't change the trend. So if it's trending downward, the incidence of COVID, and you open schools, the schools don't cause a spike. So, and again, this is all very general. I don't have, the data to back that up with me right now, but I know that it's been looked at by, the infectious disease associates nationwide, and that is what they have found. And so, again, without my, my background of epidemiology, my guess is that when we can get a handle on the spread, and our incidence is definitely going down, and everybody's doing what they're supposed to do, my guess is, that's when you have the conversation about, can we safely open, and how.
Okay, 2 more questions. Brooke, you're next.
Mine's kind of a general question to try to move on, but I wanted to ask it why we have health officials on the call. So the last time that we shut down fully and we went completely online, we were in a shutdown, right? Like we were all shut down. So my question would be, does it need to look the same this time if that's what we choose to do as a board? Like, are we at a place maybe with some of the things in play, and knowing that community spread, that there would be a way in which we could suggest like a learning lab on campus one day a week? And I'm asking just because I'm just wondering if this all has to look the exact same based on where we are at in the community as well as the school with spread, or is that even something that a medical professional would have input with? Like, maybe if we're going to go online, it doesn't have to look the same because we do have a little bit more wiggle room because we're not in a full quarantine.
Before we get a response to that, I want to go back to what our charge is. And our charge is very narrow from the school board, which is identify the metrics for movement into hybrid and remote. And so, we're not being asked to identify hybrid or remote. We're not being asked to go into these broader areas. And so I'm going to really insist that we stay with what we were asked to do. If the district were to come back, if the board were to come back and say, okay, now solve all the other problems, then I'm sure we'll all be happy to get together and do that. But I want us to really focus on what the narrow expectation is. Amy, did I see your hand at some point? Okay, good. Go ahead.
I'm a little fuzzy on what I really just want to ask Dr. Zog, and we go way back to March, maybe even February. I can't even remember at this point. But I think you and I should go to Vegas, and I'm not like a really gambling person, but if we were to go, and heavens knows you need like a year vacation after this, that if you had to bet on a metric for our group, all in, all in, we're talking big money here, Dr. Zog, what would you bet on for this group, for this school?
I'm not taking you to Vegas, Amy. I don't gamble, first of all. And that question really set me up. So there's a few things, I can't pick one, but there's a few things that I'll just tell you that I see that really, we look broader community. COVID is a serious illness. It can have a really negative impact on a lot of people. But we also recognize that there's a lot of other health issues and public health issues that are co-occurring, and some more so than they were pre-COVID. So when I look at some of the situations that are really important drivers for us, and for us as a district, we look at what the healthcare capacity is, because we're, again, wanting to say, what's kind of that threshold for us to really say we really need to get serious as a community and adopt some behaviors to help improve the health of the community and protect the health of our most vulnerable population. So that's something that we look at. And I don't know, I mean, I'm not an educator, so this is not my area of expertise. But when I look at like some of the school settings, I think of even some of the long-term care facilities that we work in, and it comes down to staffing a lot of the time. Do you have the resources, the staff to teach? Do you have the, all the support staff, the janitors, the bus drivers? That infrastructure is so important to maintaining a safe environment and good learning environment for the schools, that I feel like is something that has to be considered. And just as we would consider it for our organization or our long-term care facilities or our healthcare facilities. And you don't want to get to that point where you're really going to go off the cliff and not have any infrastructure available to help. And you have no option even for online learning. So I don't know that that's really, an answer, but those are the metrics and cases, depending on, if you look at just say case numbers, I think that was mentioned, that's important, especially like when there's limited testing and you're only testing asymptomatic people. But as we have more testing available and we see more potentially like larger testing efforts of workplaces, long-term care facilities, healthcare facilities, you're often going to catch a lot of, asymptomatic and other, just the amount of testing or the test positivity, number of new tests coming back positive aren't necessarily always a good indicator. So you can't look really just at one, is what I'm trying to say. And I know it's a really challenging job. When we went through the efforts of putting together our health alert levels, we had these same discussions, and we took that as a really serious charge because our community was going to be relying on that information for decisions. And so, sorry, I don't really have a good answer for you. But.
Okay, Melissa, I know you wanted to make a comment. Nathan, I think I saw your hand up, and then we're going to close down the conversation for this evening and move on to the next phase. So Melissa, did you want to make a comment? I'm going to go ahead and read what you wrote. We're having some audio issues there. Those of you who haven't seen it, I have something to say about the logistics of things from a session I had with the substitute coordinator yesterday and today when we move on from the health professionals. So we'll come to you here. Are there any strong objections to moving on to the next phase? Thank you. Okay, those of you from the district and Dr. Womack, you're certainly welcome to stay. I know that this is better than whatever social life you might have, but we may end up with input that you can provide as we go on. I am still committed to getting done tonight by 6:30. But thank you so much from the health district. Thank you so much, Dr. Womack. This has been very helpful, and we are very grateful for your time this evening.
Yes, thank you. Good luck. And I just want to say, I know we're all coming from different places, but I think we're all trying to go to the same place, which is away from COVID. And so really appreciate you guys getting together and making these important decisions. Take care.
Thank you.
Yes, thank you, Roger. And if you or any of your members of the committee have additional questions, feel free to reach out to us anytime.
Thank you. Okay,
Thanks for having
so
us.
thank you. Thanks, Rachel.
Can you hear me?
Yes.
This is Melissa. I put my headphone in and it worked.
Okay.
So what I wanted to say, one of the days last week and then yesterday and today, I was in with Tina McMullen, who is the substitute coordinator for Nampa, because I was getting set up to be a substitute teacher. And there were just some numbers that I wanted to share with you guys that she kind of wanted me to make you aware of. In a normal year, she has about a 95% fill rate as far as being able to fill those substitute needs in the schools. And today it was only a 69% fill rate, and they were pulling people from the district office just to make it so some of the schools could be open. She even has had subs in the offices of schools because their entire secretarial staff was out, things like that. And the reason I wanted to bring it up is I will own that I'm on the side that says, hey, let's keep our kids in school if at all possible. And so that's the side that I got chosen to represent on the, kind of the parent side, not side, but team or group or whatever you wanted to say. But anyway, I will say that I'm on that side, but seeing the logistical nightmare that they're having to deal with of, she has a list of like 280-ish substitutes, and she's only getting about a quarter of them who are willing to come in on a daily basis. And so she has the same subs that are working day in and day out, and a whole bunch who won't come into work because either they can't because they're moms who now have their kids home, all but 2 days a week, or they can't because of whatever other health reason. And so anyway, while I do want us to keep our kids in school as much as possible, there's a logistical nightmare that they are dealing with on that side as well that I just wanted to show us too.
Thank you. Let me just help us pivot. Nathan, I think I saw you wave me off after you raised your hand. Is that right? Okay. I'm getting a little pushback on my definition of what our task is, and so I want to address that. First of all, I think it's worth having a conversation about whether the holidays are a metric. So that's one of the questions I'm getting is just approaching the holidays, is that something you want to define as a metric that it's coming? We can have a conversation about that. However, I have been given a task by the school board that is very narrowly defined. I don't have the authority to go beyond it. And so I'm going to insist that we stay within those narrow parameters. So and the other thing I want to say is simply that I think all of us appreciate that if you go to a fully online scenario, there are consequences on the other end. There are social and mental health and potential spreader issues as a part of that. Yes, if you stay open, there are consequences. This is a really nasty situation, and so all we can do is the best we can do on this. So I think I saw Kyler raise a hand, but what I want to do between now and 6:30 is decide on the process forward, and I'll give you some options to get that started. But Kyler, did you had something you wanted to add?
Oh, no, I was just, frankly, I was going to distract further, so I'll refrain at this point.
Okay. I apologize, but that's where we're at. And that's where I'm gonna stick, hold to our guns here. So we have 15 minutes. We're not going to get it done tonight. There are a couple of ways to do this. One is for everybody to take a deep breath, take a day, read the material that's available, think it through, and we come back fresh on Thursday night and plow ahead. And just sort of start with an open conversation and see where it leads. Option 2 is we can create a subcommittee that would prepare for Thursday's meeting, say 3 options that to start the consideration. I don't know that everybody wants to commit another night, or if we've got 2 or 4 or 6 people who are willing to do that, that's an option. But let's take 8 minutes and bounce around thoughts on how we might go forward. I'll start with Samantha.
Referencing your subcommittee idea, would me and the mouse in my pocket, would the people who are on that committee have access? Would you provide them the information of the emails that came to you and from everybody, like the information that people provided you about suggestions for opening, or I mean, not open, but staying in hybrid or going virtual?
You do have those, and I would be happy to provide them again. But the 2 sheets of information that I provided, one was sort of the list of information you wanted, and the second was the list of potential positions to take, compromise positions. Those have been emailed to you, but I still have them, and I would be happy to provide them again. Other thoughts? Yes, Brooke.
So I'm not on either side. I really am just for the community. I did want to throw out a statement. And the one thing I want to say is I do want to remind everybody that when we did this the first time, we were on a complete lockdown, right? Everything was closed. So I do think, just being pragmatic in my thinking, that this would look a little bit different this time if that's the decision that we make. And I do just want to throw that out there because I am a parent. I do believe in face-to-face learning, but I do think that there are differences because our community is not on a lockdown. That's just not how it's working. The other thing that I wanted to ask you specifically, Roger, just so that I understand exactly what we're talking about. When we're throwing out compromises, if I say something like, and I'm reading just in the comments, this is just a maybe. If I say something like, can we keep elementary open and close secondary, is that outside of our scope? And I'm asking that so that I know when I'm throwing ideas out there, because really, if I hear what you're saying, then it's just, do we stay open, do we stay closed, and we go directly back to the plan at hand? So throwing out some of those ideas would be too much change. Am I understanding that correctly?
Let me avoid that question the best I can.
Okay. And I wasn't trying to make it a loaded question. I just don't want to waste my time on things that we can't.
Here's what I'm going to do. I'm going to read the motion again, and you tell me. The superintendent convene a stay open committee made up of equal parts classroom teachers and parents to identify the metrics for movement into hybrid and remote. Now, to me, that does not say one plan for elementary, one plan for, and I get that you want to go beyond that, but I don't think that's within our purview. Kim?
No, I was going to agree with that as well. Like, I don't know if we have the ability to create a metric for elementary and a metric for our secondary, because right now the original metric didn't have any. And one thing I see, Biff, raising your hand, including in the primary, the possible of our schools like Union and Gateways that have the ability to social distance better than our secondary, like middle, or west, south, and stuff. I don't know if we have the ability to create a metric. Now, I'm not an elementary school teacher, so I can't put the words in the mouth of the elementary school teachers and what they're going through. So I don't know if that is the case in which the elementary school teachers have the ability to feel like that they can still go in the red. I can't do that. I do know from a high school perspective that it's really hard to social distance in high school settings, and that they are going around school to school, class to class. And so I can say in that setting that it is really hard. But I do like the idea of, if we are able to, a primary and a secondary with possibly like Gateways and Union having the possibility of maybe being in that primary possibility, because they have the ability to social distance and have less student population than we do. But like I said, I can't put words in our elementary school teachers' mouths, so I don't know how they feel about that.
Well, here's one of the things I would suggest to you is that, and I see hands, I will get to, I promise, Biff and Nathan and a couple of others. If individual committee members or jointly committee members want to add a statement to the proposal that we send to the superintendent, I don't think there's a problem with that. If you want to, you know, it's sort of like you can make your own addendum to that. I think that's fine. I just need us to as a committee, as a group, stick to the narrow task that we were assigned. Biff, and then Nathan.
So the metrics that we're using, do we have to pull from Southwest District Health, or can we do a metric that is talking about however many staff, like Southwest District Health was talking about? Can we change the method? Because that's where our metrics came from beginning, was just the red, orange, yellow from from Southwest District Health. Is that what we're stuck with, or can we design those metrics the way we want?
This is my interpretation. Where you do have latitude is on what the metric is. And so if you want to create a whole new metric or set of metrics, I see nothing here that prohibits that. Nathan?
And mine kind of goes along with Biff. Not to downplay the importance of this committee, but I'm not sure we're going to have a say after Thanksgiving if we don't have the staff to continue running our facilities. And at least from a teacher perspective, and I'm sure the parents feel this too, it's way better to know ahead of time what's going to happen, even if you don't like it, than get thrown into it simply because we don't have the staff to keep our facilities open. And so I would almost propose that we lengthen the duties of this committee by extending it and developing our metrics over time. But saying right now, we recognize that that is where we're headed. And so it's only a short amount of time between Thanksgiving and Christmas. Let's move into our online learning, since we know we can do that. And we don't know that we can sustain hybrid, and then use that time where this group can develop a really good system so that when we come back from Christmas break, we can always know what we're going to do and feel really comfortable with it.
Okay, Jean?
Nathan, I agree with you. I know you guys are tired of hearing about healthcare. I get it. We're tired of hearing.
I think we have a bandwidth issue there, Jean. You've frozen up. Let me do this, and maybe Jean will come back to us and can finish her comment. All those in favor, and this is not a public board. I'm not using Robert's rules. I'm mediating. All those in favor of just of taking a day, letting this sink in, and coming back together on Thursday without any subcommittee doing work in the meantime, raise your hand. 1, 2, 3, 4, 5, 6. Oh, it's going to be a 10-10 vote. All those in favor of creating a subcommittee to do some work tomorrow and coming to the group with some recommendations, raise your hand.
Can we vote twice?
Okay, I counted, and I may be cheating. I counted more in favor of just coming back on Thursday. 12 to 8, let's say. But it was. I think that's where where the majority, I think, prefer that. Is anybody feel strongly that that's the wrong direction? Brooke, I see your hand up. I'm down to 4 minutes. Brooke.
I don't feel like that's the wrong decision. I just really want to echo what Nathan said. So I'm parent group, right? Like, but we're all still one community. But when our schools don't have the capacity, like the ability to actually function, I think that really changes the conversation. So I just do want to say that I really am all for in-person learning, and I do believe that we have to have some type of to be consistent. But I want to echo that from the other side, that it is concerning when our schools can't function. It really is important.
Okay, Eric, and I see you, Adam.
So yeah, I mean, I've had significant experience with making group decisions. If we don't come in with some direction on Thursday, I fear we won't find the finish line. I just fear that 2 hours isn't enough time for us to start at ground zero and work our way through, given the amount of investment, emotional and intellectual investment that's already taken place in these meetings. And I appreciate everyone's input. And I think this is pretty cool that we've been able to be as collaborative as we have been. But I do worry that 2 hours is enough time. If we don't at least come in with, if not from a subcommittee, then if we don't come in with people who've already gotten some, we need to sort of homework assign, right? That you come in with some real metrics and not, it just felt to me like one of the options was, let's take a day, breathe, come back and start from wherever and then figure it out. I don't think we can figure it out in 2 hours.
Okay. Just to clarify, it's an hour and a half, so it's even more unlikely. So I'm with you, Adam.
I was just going to mirror what Brooke was saying right before from the teacher side. Today, in a cohort of 13 kids, I had 7 absent. So that is, a few were quarantined and a few were just excused. But I am seeing a definite increase in the level of kids who are gone. So it's not just teachers being out, but over half my class was absent today. And so that really removes my ability to instruct them in person, even if we were still in hybrid.
Okay, I'm going to go to 2 more people, and then I'm going to give you a choice between 2 things, and we're going to decide. Kim?
Yeah, I also want to explain also what we're seeing in the high schools when it comes, what Adam was saying is Skyview today had 159 students absent, and yesterday we had 183 kids absent. Nampa High had 195 kids absent today, and 234 absent yesterday. And Columbia had 133 kids absent today and 165 absent yesterday. And so because of that, we're seeing so many fluxes of kids in and out of the school that even trying to make sure that they can stay online and in person and all that, it's getting to be a huge, huge burden on a lot of the teachers on trying to keep up both kids in quarantine, not at school, and stuff like that.
Nathan, last comment before we try to bring this in.
Yeah, just sort of bringing to light what's being said in the chat. I think Brooke's idea was good. Our homework should be somewhat collaborative so that when we show up on Thursday, we aren't hearing 20 opinions, because we don't even have time to hear 20 people's opinions on what we should do. We need to have that sort of boiled down. And so I think a collaboration board like a Google Doc or something of that sort would be really helpful. And just to let Kim and Adam know, I actually taught a class of 1 today. 1 student. He learned music really well.
Let me ask Peter, how difficult would it be to set up some kind of chat room where the 20 committee members can participate as they have time and communicate between themselves prior to the Thursday meeting.
Are we thinking chat room or like document where they can type in ideas and refine them?
Document.
The two are kind of different.
Nathan says a document that you add that, so there's a constant record being kept and added to. I see some heads nodding. Is anybody vehemently opposed to that idea? I may run into some of you in the street one day, and I want to be okay, Peter. So some kind of a document that where it's accessible to everybody, and it creates a record and people can add to it. And I guess that would be helpful for me as well, because then I can go in and know as we begin our Thursday meeting what kind of, if we got anywhere, or if we had a train wreck.
I can get something like that put together for you guys.
Okay, so is that good? Peter will work his magic. He will send you and I a link where we can go in, we can comment, we can communicate, we can follow the discussion. It'll create a document that we can have. And I'll check in from time to time, but I'll probably stay silent unless I think I need to give a nudge. Good deal? Samantha?
I promise it's just a housekeeping question. So will this be available tomorrow, like when we all wake up from our amazing slumber in dreamland?
Peter, how long will it take you to get it up and running?
I'm here for the next couple hours, so I probably can get it done tonight.
So there's your answer. So by the time you wake up in the morning, you'll have something in your inbox. Peter, thank you so much. I know that you probably don't have anything else to do. Everybody, thank you so much for your engagement tonight. I think it was a good, productive conversation. I appreciate your patience with me and with the process. And I will see all of you Thursday at 5, by which time we may have a solution. If not, we'll have a start. Okay? All right. Thank you all. Good night.